Hi, hello, and assalamualaikum warahmatullahi wabarakatuh. So, in this slide, we're going to present our research, which is assessing post-COVID-19 pandemic perceived risk on Malaysians' international travel behaviour. So, my name is Anisha Tuzayan binti Ramli.
My name is Anis Afika binti Abdul Aziz.
My name is Farah Ruzana binti Rasid.
Firstly is research background. Fu Chin Tan and Puat 2020 has found that the tourism industry is badly affected by the outbreak of COVID-19 due to cancellations of booking and delay in travel plans because of worries about the virus. Matiza 2020 state that the perceived risk induced by COVID-19 is expected to influence tourists' decision whether they choose to travel and buy tourism product for a certain destination or not. Tourist travel behaviour will also most likely be affected by this pandemic. This is especially true for international travel.
So we have identified a few research gaps from the past research. First, Han, Al-Ansi, Chua, Tariq, Radik and Park 2020 said that even when COVID-19 pandemic is under control, the international tourism industry would still not be the same as before the pandemic, and the traveller behaviours worldwide still remain uncertain. Matiza said that perceived risk can be linked to tourists' perception of uncertainty and possible adverse outcomes caused by travel and tourism service consumption. Nair and Sinha highlighted about the importance of change in travel behaviour and decision making after a disaster, and they recommended for future studies to study on the current context of travel decisions due to the extended period of lockdown and fear of the second or third wave of COVID-19 pandemic. And lastly, the existing research, which is done by Tourism Malaysia, only focuses on domestic travel destination, and there is no research yet that we have found that focus on international travel destination.
Next is problem segments. After the COVID-19 pandemic end, the travel behaviour like making decision in choosing place, type of travel and also with who they are going to travel might be different. There is a survey by Tourism Malaysia in 2020 where it stated that 84% of respondents has changed their preference due to the COVID-19 and 71.3% of them prefer to travel inside Malaysia compared to travel internationally. Most of them also said that they prefer to travel with close family and friends. Zhang Luo and Richie 2020 stated that people might generate protection motivation measure and react differently due to the fear triggered by the infection disease like COVID-19. And the last one, Q 2016 stated that consequence of the perceived risk in the tourism industry have been recognized as one of the complex concept of risk.
Next is research objectives. Firstly is to identify the types of perceived risks post-COVID-19 pandemic on international travel destinations. Objectives 2, to determine the influence of the perceived risk of post-COVID-19 pandemic among Malaysia traveller future travel behaviour to international destination. Research question is, what are the type of perceived risks of COVID-19 pandemic available international travel destinations? And question 2 is, what is the influence of the perceived risk of COVID-19 pandemic on future travel behaviour of Malaysia international traveller?
This is the research framework used in our study. For our IV, it is post-COVID-19 pandemic perceived risk, where we study on 3 types of risk: health, psychological and social. This is adapted from Matiza 2020. For our DV, it is travel behaviour, which is adapted from Tourism Malaysia, Wachuni and Kusumaningrum, Cohen, Batabial and Deyali. For our hypothesis, H1, there is a significant negative relationship between post-COVID-19 perceived risk on Malaysians' travel behaviour to international destination. Our H1A focuses on the health risk, H1B focuses on the psychological risk, and H1C focuses on social risk.
Next is the significance of study. There are two, which is academical and practical. For academic, the study will benefit the future prediction for research and study. And actually, Tourism Malaysia has already conducted a survey to study the tourist behaviour of Malaysians after MCO, but they only focus on the domestic travel. And in 2020, Tourism Malaysia stated that the typical tourist behaviour of the traveller is they did not fully stop the leisure travel, but they tend to choose a place with less crowd, and also they did not prefer to travel in group. And for the practical, this study will help the travel service provider to predict the future international travel behaviour to develop effective strategies. This also can be the basic guideline for the tour companies to predict the future international travel behaviour of Malaysians after the pandemics, if the pandemics ever happen again. And the last one is this study also can help the tourism stakeholders to determine the Malaysians' perception about travelling after the COVID-19. And they also can predict the type of destination will be in demand.
This is our literature review. For the first topic, international travel destination, the Mindanao Times 2020 said that Asian countries attract 133.1 million visitors in 2019. Global Data 2019 added that foreign visitors to Asian region is projected to rise up to 155.4 million in 2022 at an annual growth rate of 4.72%. A survey by Peabody 2019 found that Thailand, Indonesia, and Singapore were among the most popular countries visited by Malaysians. For the second topic, perceived risk of COVID-19, Matiza found that health, psychological, and social risks were among the perceived risks induced by COVID-19 that can affect tourist behavior after the pandemic. For the topic of COVID-19 pandemic, Fu, Chin Tan and Puah 2020 found that some of the impacts of COVID-19 pandemic on tourism industry includes cancellation of bookings and postponing travel plans. Hotler et al. 2020 found that COVID caused higher risk of all types of trips, so people avoid traveling to places where they perceive there is medium to high risk. For the next topic, which is tourist behavior, Tourism Malaysia 2020 also defined willingness to travel as intention to travel. In this case, it focused towards overseas travel for Malaysian travellers after COVID-19 pandemic. For the types of destination, Wachuni and Kusumaningrum 2020 found that Indonesian tourists prefer nature destination after COVID-19 pandemic, while Chinese tourists prefer travelling to the suburbs and countryside after the SARS pandemic as found by Wen et al. 2008. For the types of tourists, Cohen 1972 has categorized it into 4 types, which is organized mass tourist, individual mass tourist, drifter, and explorer. According to Batabial and Deyali 2013, purpose of travel can significantly explain the typologies of tourists, their activities, length of stay, education level, and travel intensity.
For the research design, this study used the quantitative approach where the data collected using survey and questionnaire method. And this study also used basic design, which is correlation study, that aims to regulate whether the variable, which is perceived risk of COVID-19 pandemic, will affect the outcome variable, which is travel behavior. Correlation is a kind of mutual relationship where two or more variables are dependent to each other and also linearly related.
Moving on to population and sample, our population of the research is 11.9 million Malaysian outbound travellers. For sample size, we chose to follow the Creasy and Morgan table, where they said that the sample size for a population above 1 million is 384. So we take 384 respondents for our sample size. For the sampling design, we chose convenience sampling, which falls under non-probability sampling.
Next is questionnaire design. Survey questionnaire is close-ended. The language used in the questionnaire is English. If you can see at the table, for independent variable is perceived risk of COVID-19, which is healthy, psychological and social. For independent variable is travel behaviour, willingness to travel, types of destinations, purpose of travel, and type of tourist. 5-point Likert scala will be used to identify items in all dimensions, ranking from 1, strongly disagree, to 5, strongly agree. Next is plan for data collections. For pilot survey, sampling techniques is convenience samplings. Data will be collected by Google Form and displayed online. Target respondents is 30 respondents. Target duration is 1 week. For data collection, sampling techniques is convenience samplings. Data will be collected by Google Form and displayed online. Target samples is around 400 samples. Target duration is 3 weeks.
The next one is plan for data analysis. The survey analysis will be conducted using Pearson's product moment correlation. In 2018, Rosa and Kant stated that the Pearson correlation coefficient is the measurement of strength between the two variables, and it takes value in closed interval where one of the variable is positive and another one is negative. We consult the senior lecturer and they advise to use Cronbach alpha to test the reliability and validity of each item in the questionnaire. For the data analysis method, for section A, which is the demographic, we are going to use the descriptive, which is using the frequency, mean, standard and standard deviation. And for section B, which is research objective, we are going to use the simple linear regression. And also for the section C, which is research objective 2 and also research hypothesis, we are going to use simple linear regression too. So that's all for our research presentations, and thank you for watching.